We are truly a city in mourning this morning, and a physician and mindfulness instructor, Dr. Romie is joining us this morning to talk more about how we can all cope. And Dr. Romie, I think when we called you yesterday, the story about this gator hadn't even happened yet, and it's as if it adds insult to injury, as if our hearts were not broken enough.
They break over even wider. Any parent watching this, any family member that's come to Disney World hurts, absolutely.
What do you want the people in this city to know after hearing once again another such tragic story today?
You know, Amy, what we want people to know in the face of the terrorist attacks and this tragedy this morning with the child is that it is normal to have feelings of grief and anger and negative emotions such as anxiety or depression, even if you're not sitting here in Orlando or directly affected or know any of the victims. Some of the symptoms people are having that we're getting calls in the office is difficulty sleeping, inability to focus at work, not even wanting to engage at work. Most of all, feeling guilty that you're allowed to go on with your life as normal.
Oh, so you mentioned that because we did hear from several of the victims yesterday who said they have survivor's guilt, and it is heart-wrenching to hear that.
You know, we're not only hearing it from the survivors, Amy, we're hearing it from members at large of our community. Because, you know, we are one community. As a human beings, we identify with being citizens of the city of Orlando or the LGBTQ community. So when one member of the community is hurt, our collective hearts hurt. That is the concept of sympathy and empathy and compassion.
We want to talk about how to talk to our children as well, because it is, at this point, nearly impossible to shelter them. I know a lot of parents are saying we're trying to keep the TV off, that kind of thing, but what do you say to them?
When we look at the data compiled from the American Psychological Association, Amy, we break it down into helping and healing. And we also look at the ages of the children. When it's preschool, it is best to try to shield your children, but in this day and age where children are on digital devices and have access to social media, you really need to talk to elementary school children about what they know and answer them in simple terms. Middle school and high school children likely have access to the news, but maybe not necessarily the true news, but more sensationalized news based in fear on social media. So it is very important to talk to them that they have a safe and secure home, and that there are adults that are out there that are helping to resolve this problem, and it may go slow. And everybody has this need to want to do something. We feel helpless. And so this is where the helping comes in. You know, whether it's attending a prayer vigil, working with your children to create an art project to send to the victims' family members, you know, donating. You know, we've seen this outpouring of love of people donating blood. And people from outside of Orlando are contacting us and saying, what can we do? You know, ask people to post something positive, a positive intention, a prayer for Orlando. It is very uplifting to the people going through this to see positive images, and leave all the rhetoric about politics and policies behind. This is a time where we're mourning the loss and about to start funerals, and still praying for the people that are still hospitalized.
Dr. Romie, such wonderful words. How can our viewers find you?
More information at drromie.com.
Thank you so much.
Thank you.
And thank you for your prayers and your heartfelt words to the community. We really appreciate it.